Okay, I think now this is visible to everybody. Okay, I think now this is visible to everybody. I have to. Are you able to see my screen now or not?
Yes, sir.
Yes, screen is visible.
Screen is visible to you, but it is not
Yes, sir.
visible to me. Okay, now it is visible. Fine. So let us
Yes.
start. So good evening. Once again, we are back with the lecture series. I am Professor Harivansh Chopra, and I'll be today talking about a very basic lecture which should be taught to all of you when you enter medical college in the first year. It should be the first lecture, right? Because the first lecture should always try to introduce the subject, and the subject over the years have changed its name. Uh, it's changed its name, right? So we'll be talking about that, and then I'll be talking about my own concept, what I understand by these changing names, and I'll be giving you few definitions given by the people, and then we'll be moving forward to the definition which is given by our national association, that is Indian Association of Preventive and Social Medicine. I think that is not given in any book yet, but then it might come later on, right? So, or maybe the IAPSM book, which is there, it may be there. So that way we'll be proceeding forward. So let us move forward and try to understand how our subject has evolved. And you must remember, again, the basic things are very, very important, and basic still applies as far as the health of the people is concerned. So what has been the changing names? I will not be going into the chronological order or the historical uh, year-wise phenomena. I'll be just telling you the concepts. What is more important to understand, right? So these are the various basic names which have been in vogue or in use from a long period of time. The first name was hygiene. Then the name was changed to public health. Then came the concept of preventive and social medicine. And then the name finally changed to community medicine. And there are very little differences amongst all these. But then whenever it is asked, and I have seen it over the years, that whenever even in the viva we ask a student, whether it is an undergraduate or a postgraduate student, what is preventive medicine? Can you define preventive medicine? So they are not able to answer. So that is why I say it is important to understand what is the meaning and what is the definition, right? And what is the concept. And I always say this is the best subject. Why? That we'll explore further. So let us start with the word hygiene. Now, hygiene word originates from the Greek word Hygia, the Greek goddess of health. And she was the daughter of Asclepius, and her disciples were called hygienists. The other daughter was Panacea, and her disciples were called Panatians, and they were practicing the curative medicine, while the hygienists were practicing the practice of health, right? So that was the basic beginning. That was the basic beginning. That is the hygiene. Then, what is the definition of hygiene? Hygiene is defined as science of health and embraces all factors contributing to healthful living. What is hygiene? Hygiene is science of health and embrace all factors contributing to healthful living. You will have to understand that we are having different kind of diseases in our country or in the universe. And even if we take the example of now COVID, which is there now, what COVID has pushed us back towards the hygiene part. Now all of us are talking about hand washing, which is the first component of the hygiene, right? This is the basic component of the personal hygiene, and this is also called one of the best intervention of public health, right? Then we have been asked about to maintain the respiratory hygiene or respiratory etiquettes. So you see, a lot of infectious diseases can be prevented by simply practicing good hygiene or good practices which contribute for the maintenance of health. And COVID is the perfect example, right? So it includes all those factors which we'll be talking about a bit later. What are the factors which determines the health, or what are the health determinants, right? So that is what is important, and it was taught as hygiene. And I still remember, maybe in early 70s, the book of community medicine was hygiene and public health, something like that. So this was the phenomena which was going on. At conceptual level, this is the branch of medicine that strive to attain highest level of personal and community hygiene. Of course, you see, even if we take the present example of COVID-19, and we say, of course, now vaccination is going on, but we say wearing of mask, maintaining distance, and hand washing. Again, these are three best practices, and these are the again are the components of hygiene. There are so many good practices which has lost its importance as the urbanization and industrialization has happened. I will give you the example of COVID again. You see, in previous times, and it's still in some communities, again, nobody allows to enter their house while you are wearing your shoes. What was the concept behind that? Again, the COVID has again proven that the surface transmission. If somebody is coming from the surface and droplets are there on the shoes, then the shoes comes inside. Then the infection will be coming inside. So that was the concept, right? Right from birth, if you look at it, what was the concept that they used to keep mother and child separate in a separate room? Why? Because again, they wanted to prevent the occurrence of infection. So from life to death, there were so many good practices which were there. But as we went into the process of urbanization, modernization, and industrialization, all these practices were forgotten. And probably this is the reason why the COVID is not very much high in India. We do not know exact reasons. There are a lot of unknowns. But maybe the way we are living, that is making a difference as far as the incidence of COVID is concerned. So we do not know the exact reasons. But yes, another example I will give you. You must understand, all of you must have heard the name of the disease tuberculosis. You see, all the anti-tubercular drugs were discovered around 1950. So what was happening prior to that? And if you look the prevalence of tuberculosis in the industrial world, or in the advanced world, on the developed part of the world, simply improved in the lifestyle made a dent, and the prevalence of tuberculosis came down. Tuberculosis came down without the help of drugs. And nowadays, again, the hypothesis is the same tuberculosis. Maybe BCG vaccination is providing us some kind of a cross immunity, because it is very much rampant in our country. Everybody is given BCG vaccine, while in the developed part of the world, we don't use the BCG vaccine. So that you'll have to understand the good practices which are there of any culture, and they have a bearing on health. They must be promoted. They must be promoted. That is the idea behind it. Then the term came public health. And what is public health? Winslow gave the definition of public health. And he said that public health is defined as the art and science of promoting health, preventing diseases, and prolonging life through organized community effort. Right? So what is the key in public health? You see, when we say public health, it means that the community involvement has to be there. The community itself has to come together, and indulge in those good practices which help in the promotion of health, which help in the prevention of diseases, and which help in the prolongation of life. So that is the public health, right? That is the public health. And there are so many P's, that is promotion, prevention, right? Partnership. And nowadays, another P is used, that you have to predict, prediction. Prediction of diseases is another part of the public health. But this is the basic definition of public health, which all of you must remember. And this is given by the Winslow, that public health is an art and science of promoting health, preventing diseases, and prolonging life through organized community effort. So it is not only at individual level, it is at community level. Basically, it is at community level. And who is a public health worker? Anybody who is indulging in these activities is called as a public health worker or a public health specialist, right? So why it has stopped? It is not moving. Okay. Then we go to the next. Then comes the term, what is medicine? What comes in the mind is, what is medicine? Because again, if you understand, only then you will be able to understand what is preventive medicine and what is social medicine. So we say medicine is the art and science of healing. What is medicine? Medicine is the art and science of healing. And science of healing is taught in medical colleges. The art of healing is not taught. And that is why you must understand, in developing countries, you will find the alternative systems of medicine working very well, or maybe the quacks, they are still working. And it's a perfect example that these people are very much connected to the community, and they know the art of medicine much more than the modern medical specialist, because it is not taught how to communicate. It is not taught, and it is our subject only, which talks about communication, which talks about health education, which talks about IAC activities, right? Which talks about BCC and so on. So you will have to understand the importance of the subject also, right? So this is medicine. Then we come to another term, which is known as who is a doctor? To whom you call it a doctor? A practitioner of medicine is called a doctor. Anybody who is able to alleviate the suffering of the people with his professional knowledge and skill, right? That is what you do basically when you acquire your professional skill and knowledge, and then through the course you learn, and then you are awarded the degree, and that degree again you are doing the same job. Then that is, the doctor is one who cures the disease and the individual. It's not only curing the disease itself is sufficient, and that is why a lot of people talk about the mind-body connection. So you will have to cure the individual in totality, right? So that is a doctor. Then another question comes to the mind: who is a good doctor? Now, what is the difference between a doctor and a good doctor? Anybody would like to say anything?
Sir, a good doctor, sir, also tells about its prevention part, sir.
Okay. So, who is a good doctor? A good doctor is one who not only treats and the prevent of the disease in the individual, but also in the family. And you must understand, it is our subject which is talking about prevention. Rest are only talking about the curative portion. So, by definition, when we say you are a student of community medicine, it means that from a doctor category, you are entering into the category of a good doctor. Then raises another question, that is another important question, is who is a very good doctor? We know who is a doctor. A doctor is one who is healing people, who is curing the disease as well as individual. A good doctor is one who is curing the disease individual as well as preventing the occurrence and recurrence of the disease in the individual as well as in the family. And who is a very good doctor? Who is a very good doctor? Yes. One.
Sir, a
Okay.
very good
Yeah.
Sir, a very good doctor maybe who addresses the health not only as the good doctor, that is as a holistic approach, but also have the look into the future. That is for the who will work for the current as well as the future mankind.
Okay. So wonderful listening to your thoughts. So as far as I am concerned, what I could understand, a very good doctor is the one who treats and prevents the occurrence of the disease in the individual, family, as well as in the community. Right? So if you can prevent the occurrence of disease in the community, and what is the perfect, COVID is the perfect example. If you could prevent the COVID infection in the community, again, ultimately government realized, right? Government realized, but realized it late, but realized that it is the people from community medicine who will be able to perform this job. No curative medicine person can do it, right? So if you have joined community medicine, then you must understand from the category of a doctor, you have already entered into category of a of a good doctor, and ultimately a very good doctor. Ultimately a very good doctor. That is what is the subject. That is what is the beauty of the subject. And that is why I always say, as when I was a postgraduate, my professor used to tell me, look, my postgraduate must know much better than the postgraduate of medicine, pediatrics, and OBG and gynae. And he was double MD. He was MD PSM as well as MD medicine. And why he used to say so? Because if you have to apply prevention, then you have to have a thorough knowledge. And the other thing which you must remember, which a lot of people may disagree with me, but I always say that you cannot leave behind the treatment part to someone else, right? So it is your job to treat. And if you are able to treat the illness, say in the early stages, you are able to diagnose the diseases in the early stages, then you are preventing complications, you are preventing deaths, you are prolonging life. And that is what is the definition of public health is. So these are the components which you'll have to understand, right? So a very good doctor is one who is not only going to treat, but is going to prevent. And that is the futuristic approach probably the Satabdi was talking about, that when you are preventing, that is, you are preventing the disease to happen. That is a futuristic approach. And that too, not only in the individual, but in the family as well as in the community. So then from here, then we have understood what is medicine. It's art and science of healing. Who is a doctor who heals, who is a good doctor who not only heals, treats, but prevent in the individual and in the family. And a very good doctor is one that who treats and prevents the occurrence of disease in individual, family, as well as in the community. So if you have understood this, and these are all the jobs responsibility of a community medicine specialist as and when we'll going further, then comes the term prevention. Again, yes, what is prevention? And again, this is my definition of prevention. Nowhere it is written in any book. And I always say that when we talk in Hindi language, we always say there is a Sandhi Vichhed in Hindi language. There is nothing like that in English language. So if we try to break this word prevention, so what we get from breaking this word is pre-event action is called prevention. Any intervention which is taken prior to the occurrence of event is called prevention. It's the simplest one-line definition, which is explanatory and it's applicable to all levels of prevention. Whether you are going to talk about primordial prevention, whether you are going to talk about primary prevention, whether you are going to talk about secondary prevention, or whether you are going to talk about tertiary prevention, right? So this is the simplest definition of prevention. And you can quote me that, yes, this is given by Professor Harivansh Chopra, that pre-event action is called prevention, right? So you'll have to understand, because next thing we are going to talk about the definition of preventive medicine. So what is preventive medicine? What is the definition of preventive medicine? Now, it's very simple. It is defined, because it's a word, medicine is there in it. It is defined as an art and science of promoting health, preventing diseases, prolonging life, preventing births and deaths. So you'll have to apply both art as well as science, and you are going to talk about the interventions which are there in the pure primary prevention interventions, right? So you will be promoting health by health promotion activities, by educational activities, by providing nutrition education, by bringing about environmental changes. Then you are going to maybe using the chemoprophylactic agents, maybe vaccinations, or maybe other things for the prevention. And then when we say prolonging life, meaning by that you have to apply the early diagnosis and treatment, right? To prevent the occurrence of complications. And once you are able to prevent the occurrence of complications, definitely there is no chance of person dying, right? So that way you are going to prevent. And not only deaths, you are going to prevent the births, which is the major biggest problem in our country. Population is the biggest problem. Population explosion is the biggest problem in our country. So it's a simple definition which you'll have to remember is what is preventive medicine. Is an art and science of promoting health, preventing diseases, prolonging life, preventing births and deaths. And it can be practiced at all levels, at individual level, at family level, at community level, at all the levels it can be practiced, right? Then we come to the next term, which is known as social medicine. And whenever we ask what is defined social medicine, so then it becomes the student becomes so perturbed, is not able to answer social medicine, social medicine, social medicine. Again, the definition is very, very simple. One, it is the study of the social factors which have a bearing on the health. It is the study of the social factors, right? Which have got a bearing on the health, and there are a lot of social factors which have a bearing on health, right? And the application of the knowledge and the application of that knowledge for promoting health, preventing diseases, and prolonging life. Right? So you cannot deny the interactions of the social factors as far as the disease causation and the disease prevention is concerned. So you'll have to study the social factors which are having a bearing. And then you have to apply those factors. And I gave you the examples. I gave you two examples. And then now again, you see the jet age, you see where there is a lot of intermingling. People are flying from one country to another, and their mutations are happening in COVID. So from one country, the mutation is entering into the other country. Again, these are all social factors, the socio-economic factors, which are playing a part, playing a role. Educated people are not following the precautions all over the world, and you can imagine what is happening, right? So these are again important things to remember, that these are the social factors which have got a bearing on the health. Maybe you are more educated does not mean that you are indulging in good practices. There is a debate which was going on in the biggest, the oldest democracy of the world, that is United States of America. There was a debate on whether to use mask or not to use mask, right? Now with the change in the administration, the masking has been made universal and compulsory. Still people don't follow it. So these are the factors. You'll have to understand what is their understanding of the disease, and what social factor, what cultural factors are there, what religious factors are there. These are important things. Again, if you talk of vaccination, I can give you one example which we always talk about. When we talk of measles vaccine, we talk of a strain which is known as a Admoston Jagrub strain. Why it is called Admoston Jagrub strain? Because Admoston was the child from whose throat the measles virus was cultured. And that is why the name was given. And what happened? Ultimately, when he became adult, he got married, he had a son, and he refused to give vaccine to his son, the same measles vaccine, which was in his name. So there are a lot of social factors which are there. What is there in the mind of the people, it is at times becomes very, very difficult to understand. And then you have to study those factors. And people, when they join together, they decide something which is good or which is not good themselves. Then that is why we say that if you involve the community and there is a community concurrence for accepting or rejecting the intervention, then it becomes a strong tool for development and change, and it becomes a strong tool for prevention of diseases. Polio is a perfect example where people ultimately understood the importance of the polio vaccine, and that is why once they understood what was happening, people were going to the religious groups also, and they were doing it. And now, even in COVID era, there is a lot of vaccine hesitancy is there. It's not only in the developing part of the world, but all over the world, there is a vaccine hesitancy. People are still bothered about what is going to happen. So there are so many other factors which play the role. So you'll have to understand and study all those factors, whether it is related to the educational status, whether it is related to the economic status, whether it is related to the emotional status, whether it is related to the intellectual status, whether it is related to the spiritual status, right? Or occupational status, and so on. So many factors are there, and all these factors you'll have to study, and then you have to apply all those factors for the prevention of diseases, promotion of health, and prolongation of life. That is the definition of social medicine. Then moving forward, there is another word which is used as a socialized medicine. Anybody will tell me what is the difference between social medicine and socialized medicine?
Sir, in socialized medicine, health is responsibility of the state, sir.
Yes, this term actually came from USSR, right? This term came from the USSR, and all of you must understand USSR. Now it is not USSR, it is Russia, but previously it was known as the USSR. And if you can get a document, what is known as a public health paper by WHO, Healthcare Delivery System in USSR, which is of course there in our library, but then yes, you can search for it. If you read that, then you will understand probably the concept. Yes, you are absolutely correct when you said, Gargi, that socialized medicine is the health is the responsibility of the state or government, and every intervention and expenditure is provided by the government. And people of that country are provided medical care free of cost, free of cost. But whether it really happens in reality or not, that's a big question mark. And when we say health is the responsibility of the state, again, you will have to understand in India, health is a state subject. That's a different issue. Responsibility of the state means here state or government is equivalent. And when we say health is a state subject, it means that yes, it is coming in the state list of the constitution, and ultimately how the health is going to be provided to people living in the different states, that the state government will decide. Of course, there are so many centrally sponsored programs, but again, all these programs are implemented by the people working in state health services. So you will have to understand this. And whether in reality it is provided, everything is provided free of cost, or it is on paper, that's a different issue. But then that is the concept. That is the concept of socialized medicine, which started from USSR basically, and that you'll have to understand. And then here we will like to talk a bit more about it, that what are the systems of providing medical care in India? What are the various system? First, we have already talked about, that is the socialized medicine, that is the care provided by the state, and all of you are aware of that, that yes, in rural area, starting from village level, we have Anganwadi centers, we have Ashas as link person, then we have sub centers, then we have primary health centers, then we have community health centers, and then we have district hospitals, and then we have medical colleges. And in the urban areas now, again, of course, the urban health mission was launched in 2013 only. So there has been various types of posts which are providing the various kind of services, all the national health program as well as the MCH services are being provided by these urban health posts, and that is still developing. It was not very much developed. If it would have been developed to an extent, then yes, probably in the urban area, the COVID would have been brought under control much earlier than this, right? So that is the one concept by which you get and the healthcare. Then the second concept is again insurance based, that is through CGHS, ESI, or medical insurance. But ultimately, then you will have to go either to a government sector or to a private sector, because you have the insurance. That does not mean that you are getting the medical care. The medical care you will be getting either from the government system or from the private sector. So you must understand India is in a unique situation. It's very good. I'll say that you want to get yourself tested for any super specialist test, say for MRI. If you go to America or you go to Canada, what you will find, suppose you want to go for MRI, first of all, you will have to go to a GP, and then GP, if he agrees that you need that investigation, then he'll fix your appointment with the specialist, which itself will take maybe weeks. And when the specialist again examines you, then he will think that that test is required. Then he will fix up a date with the radiologist, and then maybe after weeks or so, you will be able to get the testing done. And in India, if you have the money or if you have the insurance and if you are hospitalized, these tests can be done within a span of hours or days. So that is the advantage of having both the government system as well as the private sector. Of course, the private sector is there, so one has to spend money, and that how you can minimize, that is again the insurance based model. But then again, you will have to understand, of course, the OOP, that is what we say is the out of pocket expenditure, is much more in comparison to the government, which is spending money on health. And this OOP, again, the outpatient OOP is much more than the inpatient OOP. Right, inpatient can be taken care with the help of insurance, and Ayushman Bharat is the greatest step towards that. And so many people are getting the benefit of that. But yes, again, there are a lot of other interventions which are being carried out, like putting a cap on the various devices, and then moving towards generic drugs and moving towards Jan Aushadhi Kendras. That is again trying to decrease the cost. So these are the factors which are playing a role as far as the universal health coverage is concerned. And then there are indigenous system of medicine like Ayurveda, Unani, and homeopathy, which are very, very prevalent in our country. And of course, there is a lot of debate and other things which are going on, that how this Ayurveda people are going to, are they practicing allopathy also? They are doing a lot of things. Of course, that's a question of debate. So we will not be discussing that. Then there is the alternative system of medicine. What is that? There is a naturopathy, there is acupressure, there is acupuncture, there is electro-homeopathy, and so on. So there are so many other systems which are working in our country. So this is the system how we are able to provide the medical care. And it is important, as a community medicine specialist, you will have to understand how the health services are provided, because you have to have the knowledge of every system, right? Then we come to the word community medicine, and what is the definition? The Faculty of Community Medicine of the Royal College of Physicians have defined community medicine as that specialty which deals with the population and comprises those doctors who try to measure the needs of the population, both who plan and administer services to meet those needs, and those who are engaged in research and teaching in the field. It's a very, very tough definition, difficult to understand what they are going to do. They are going to measure the health needs of the people, right? Then they are going to plan and administer the services to meet those needs, and those who are engaged in research and teaching in the field. This is the definition given by the Royal College of Medicine, right? Then another definition given by the GM last is community medicine is the field concerned with the study of health and disease in the population of a defined community or a group. This is the simplest definition. The community medicine is the field concerned with the study of health and disease in the population of a defined community or group. What we say is community diagnosis also, right? So we'll be talking about that a bit later. Then as we were evolving, then IAPSM has given its own definition of community medicine, right? So what is the IAPSM definition, which was made by the various experts from the country, joined together, and probably it was released in the Pune conference, and I fortunately was one of the member of that committee. So what is the definition given by the IAPSM of community medicine? A science and art of promoting health, preventing diseases, prolonging life by range of intervention. By range of intervention, and these range of interventions are promotive, preventive, curative. I am highlighting here curative. A lot of people think community medicine or preventive medicine, you don't have to include the cure. They are mistaken. So it's a science and art of promoting health, preventing diseases, prolonging life. Again, the same definition of preventive medicine. What we have added the range of interventions like promotive, preventive, curative, rehabilitative, and palliative. We have explained the intervention in close partnership or in association with healthcare delivery system. That means you have to that is why we talked about the bit about the healthcare delivery system. What is the kind of system is there, right? So in close partnership or association with healthcare delivery system and with active community participation and intersectoral coordination. With active community participation and intersectoral coordination. And that is why we always say there are two types of needs in the community. One is the health need and second is the felt need. Health need is the need which is determined by the planner or the administrator, and felt need is the need which the community feels. And if you are able to convert the health need into the felt need, then that program or that intervention is going to be successful. You'll have to remember this. This is the key to success, to practice community medicine, to practice preventive medicine. That if you are able to convert the health need into the felt need, only then that particular intervention will be accepted by the community, because that becomes their felt need, because then they feel that it is their need and they will be applying that intervention, right? If the community started having this belief that wearing mask is going to prevent COVID, then everybody is going to wear mask. And if the community does not feel in that, then you may say so. Even the most advanced nation in the world would not apply universal masking. And everybody was literate. Everybody is literate in that word. So you imagine, these are the basics which you'll have to understand. If you can convert the health need into the felt need of the community, then the intervention of the program is going to be successful. So that is why I always say, that is why WHO always said that community participation means this only, right? So then what are the functions of a community medicine specialist? And they have given the various functions. They have function number one is identify and prioritize the health needs of the defined community. Again, the same things. What are the health needs of the community? Then identify direct and indirect determinants influencing the health and disease, right? So what are the causative factors? What are the risk factors? And what are the social factors associated with that? So direct and indirect determinants you are going to identify. Then prioritize and undertake intervention to address the health needs and health determinants of the defined community. Again, you are going to take intervention, but again, those intervention without the community participation is not possible. And I always say, if you want to practice community medicine, you will have to go to community. Only then you will be able to understand the subject. Only then you will be able to understand the needs of the community. Otherwise, you can never practice and understand community medicine sitting in your own chambers. You have to move out of the chambers to understand what community medicine is and how community medicine can be practiced. So it is to be practiced in the field only. Then plan and organize healthcare delivery services to address health needs through community mobilization to achieve community empowerment. Again, right? We are again roaming around that word community participation, community mobilization, community empowerment. So there are a lot of you can say there is a lack of awareness in the community, and that lack of awareness is to be converted into the awareness that is to be converted into demand. If there is a community demand for a particular intervention or particular program, then the acceptance will be much more higher and that intervention program will be much more successful. Then lead the health team and provide community oriented primary health care. Of course, that we have already discussed in the functions of a doctor, that doctor is a leader. So he has to lead the health team and provide community oriented primary health care. Then advocate for equitable, quality, accessible, cost effective, and appropriate healthcare services as the basis for achieving universal health coverage. Right? So there cannot be a compromise for the quality or accessibility of the services for people living in rural area versus people living in urban area. There cannot be a compromise on the cost effectiveness and the appropriate technology which is to be used for achieving the universal health coverage. So you will have to advocate for that. That is why the advocacy is required. That is the word people are saying, that advocacy is to be done for all these things. And this is only possible if you have worked nearer to the community with the communities, right? So that is the key. You'll have to understand whatsoever I have learned, whatsoever I have acquired that working in the field for more than 25 years. You can say so, right? So, whatever empowerment I have got through the working in the community. Whatever knowledge and skills I have acquired through working with the people, working with the patients, right? So, patient is your best teacher. So, similarly, community is your best teacher if you are going to practice community medicine. Then conduct health system research to evaluate health services and recommend measures to improve their effectiveness and efficiencies. And that is why I always say that whenever you do some kind of a thesis or a research, then again you should again look into the evaluation part of the various programs. And if you are able to do that, and then what we have been able to do recently, maybe in last 5, 6, 7 years, we have done studies on those, and always all those students who have done those studies are again have been uh, rewarded at national level by getting or by winning the best paper prizes in the various categories. So you'll have to understand what you are going to work as a young professional. You'll have to understand. And if someone with the mid-level or a senior level is also watching this, then you have to advocate these kind of research in the thesis. Only then you will be able to understand whether the programs which are being made, having the various interventions, are really working or not working, and if they are not working, what can be done so that they start working. And that is how the evaluation has to go on, right? So then the other part is the understand the role of other sectors which influence health and work with them to improve health status of a community. Again, that is again very, very important. There are so many determinants of health. There are so many sectors which are working, like sanitation, water supply, housing, education, female education, Department of Women and Child Development, Department of Education, Department of Agriculture. All these factors, they are factors because they affect the health of the community. Then we come down to the community word, which is a community diagnosis, may be defined as the pattern of disease in the community described in terms of important factor which influences this pattern. And this is a very good picture which is showing you. The upper part is showing you what is happening in clinical medicine, and the lower part is showing you what is happening in community medicine. In clinical medicine, when the patient comes to you, you take history, then you do examination, then you do perform various tests, and then you reach to a diagnosis. Similarly, in the community, you talk with the community, you look into the records, you carry out surveys, and then you reach to a community diagnosis. How many people are healthy? How many people are sick? How many people are having communicable diseases? How many people are having non-communicable diseases? How many people are having cancer, and so on. So you get to know what is the prevalence of various diseases in your area, and then you can plan the health services accordingly, right? For example, say if the non-communicable disease burden is more, then you need non-communicable services. That is, you need to have more stress on BP apparatus, maybe on glucometers, or maybe on weighing machines and assessment of the risk factors, and so on. And similarly, you need those drugs, antihypertensive, antidiabetics, and so on. If the occurrence of communicable diseases are more, then maybe you will be needing more kind of antibiotics and other things. So you will have to make a community diagnosis, and then you can plan what kind of services are required. So this is a very good example. So then what is community healthcare? It deals with the planning and administration of services that are pertinent to the diagnosis, So you have to plan the community healthcare. So this way, I wanted to talk to you about that, how we are evolved. Now, what is the ultimate status? What are the functions of a community medicine specialist? And what are the various definitions? So thank you so very much for patient listening. And let us stop the
Thank you, sir.
screen sharing. Stopping the
Thank you, sir.
share. And let us stop.